Welcome to TAL Radio English, CXO Showtime. We're bringing global CXOs on this platform to share their journey to success. Our guest today is Celeste Harrison, Chief Executive Officer of the Metagada Episcopal Health Outreach Program, known as MEHOP. MEHOP is certified as a patient-centered medical home by National Council of Quality Assurance. Celeste is also board president of Texas Association of Community Health Centers and has been on the board for over 5 years. On the personal front, she's blessed with two sons. One is a retired Army captain, and another one is an active Army captain in the Texas National Guard. We are proud to have with us Celeste. Thank you very much for joining us today.
Thank you.
Right. So as we begin, Celeste, we do see that MEHOP focusing on primary care to patients. And can you highlight the importance of providing all aspects of primary care to patients?
Of course. The best aspect of providing all aspects, if you will, of primary care is we can treat anything from a primary standpoint. So we treat the individual for their medical health, for their behavioral health. We can do their dental care. We can check their vision. And if they're a woman, we can deliver their babies and also, do their well woman, as well as all of that for children. And all of our providers can work collectively to improve the health of the patient.
Great. And is it limited to certain specific locations?
Well, it's not limited to specific locations. Our clinics are in Matagorda and Wharton counties in Texas.
Right. And what challenges and risks that you see currently today, and how complex are these based on the number of services that you're currently providing at MEHOP?
Well, the biggest challenge we have had, of course, as all of healthcare has, is the pandemic. A lot of people didn't want to come into the clinic, even though we took extensive precautions, because they were scared. So many people put off treating their chronic diseases, or even if they had something significant going on, coming in and being checked. That's the biggest challenge we have. And of course, we serve everyone. So the next big challenge would be for individuals with limited income. Although we can do everything for them for primary care, it is often a challenge to get specialty care if they need it.
Right. And you did bring about the changes that pandemic has got into play, right? I mean, how did the pandemic change the way how MEHOP delivers its services?
Well, the biggest change was how we screened patients, any individual coming into the clinic. And of course, we put in specific protocols of mask wearing and distancing and washing hands. It was particularly challenging in our dental operation, just due to the processes used in dental. Our two dentists actually came up with a industry standard, I would call it, a way to clean our rooms and to ensure that our patients were safe at all times.
Yeah, that must have been a very, very challenging situation, especially for dentists, because they need to operate right inside the mouth, right?
Absolutely. And we were the only clinic open for a long period of time, months, because of those protocols we were able to put in place. We didn't open up to routine care, but we certainly saw anyone that had an emergency in dental.
Right. And it does require a lot of financial stability. And with all these services that you're currently providing and the challenges in and around it, what are the revenue sources that MEHOP has that it has to ensure it stays financially viable?
MEHOP is a federally qualified health center. And as such, we receive a grant from HRSA, the Health Resources Services Administration, so that we're able to supplement the income we have so that we can provide for anyone that needs to seek care. We also, of course, offer revenue from, we see insured patients, whether that be public insurance or private insurance. And we also have many private grants, and we have one state grant.
And just coming back to the patients or the people who have been impacted from COVID, right? Do you think will they recover naturally, both in terms of financial stability as well as on the health standpoint? Or do you think that specific actions are required to be taken to ensure they recover in all aspects, including their mental state of mind?
I think COVID has impacted everyone. I know from our staff standpoint, it's even been a challenge for us because we haven't been able to have all those joyful events that we were having pre-COVID. We're just now opening up where we were able to get together. And I think you've pinpointed something that's critically important. COVID had such an impact on all of us for, I'll say, our mental health, because we are a people that need to be together and to work together and to celebrate together. I think over time, we will get back to that. But many people have had to seek out a little extra help to get through the difficult times. As far as physical health, I think most people are now coming back for their chronic conditions, and most people had a rapid recovery from COVID. But the concern is there are individuals that have what they call long haul COVID, and those individuals are taking a lot. It really impacted their health for a long period of time.
And apart from serving the general public, I believe you also serve the military. How is your experience serving the military personnel?
Well, our biggest challenge with the military personnel is actually getting approved to serve them. Military have, whether they're active or inactive, have various insurances, and it's a challenge to actually get approved on those insurances. And often the VA wants them to go to the VA rather than to a local clinic that could be easier for them to get to. But we have done everything we can to enable ourselves to receive those insurances. And we actually have a partner called Army Pays, which isn't serving patients, but it enables us to serve the military, and that folks that are getting out of the military that are active can look at MEHOP as a way for jobs. So we're really proud of that as well. And we do have several ex-military on staff.
Yeah, I think that should help. But with that in place, right, how do you compare the challenges and how difficult is it addressing the requirements with respect to the active military personnel or former military personnel or general public to talk about, right?
Really haven't seen anything more challenging to serve military personnel than the regular personnel.
So it's pretty much the same, irrespective of whatever the insurances that
Yes,
individuals might be having. Okay.
yes.
Okay. What has been your overall experience with MEHOP?
Well, I started here right before we were a federally qualified health center, and there were only 7 employees. So that would have been in 2008. And we became a federally qualified health center. And it's a little hard to compare patients to patients over time, but I can tell you that we have about 135 staff now. And last year we served over 12,500 patients.
That's a huge achievement on that front. I believe you get the opportunity to serve more and more patients. I mean, not basically undermining the fact that we need to have more and more healthy people out there rather than more having more patients. But thank you for being there. But since you have been involved in the activities at MEHA for a long time, and you must have been through a lot of stressful situations, how are you handling these stressful situations?
I'm a person of strong faith, and I always rely on that. We have a remarkable organization, and many of the staff have been here many years, and we rely on each other. And I think it's through our common commitment to serve the patients that and our proven track record, that now we know that if we work together, we can accomplish almost anything.
Absolutely. Working together means a lot. And is there any particular experience that you would like to share with our audience that, as part of your working in the organization, that thrilled you or inspired you to a certain level that you are more carrying that feeling along with you that you want to share with our?
One day, I walked into the waiting room and I realized that we impact everyone here, whether it might be people that can barely find their way here because they don't have transportation and they really struggle to provide food for their families, So it's challenging to them to provide healthcare. And then I can look across the room and I see individuals that might have one of the grandest homes in the area and don't have to really be as concerned about paying for their bills. So I just felt we really impact so many people in all aspects of life.
That's very, very inspiring. And Celeste, you lead a life of being a family member, and also you have a lot of things that you achieve at work. And it must be very challenging. How do you balance your work and family life?
Probably not as well as I should. I have always been a person that I said I'm kind of like a light switch. So for work, I'm either on or I'm not. So I do work many hours. My balance is I live out in the country and am surrounded by wildlife and dogs and cats, and we have cattle. So my balance is I can find serenity when I get home.
That must be a really balancing act of nature to get you rid of any stress that you might be going through throughout the day. Happy to see that you're living with the nature, Celeste. And then with that, you must also been encountering several types of patients, and you must also been seeing different people going through very, very difficult situations. How do you empathize with them?
I think the biggest thing we can do is to be kind and considerate. Said, and I've seen it written, but everybody walks in their own individual shoes. And when we do respect that, we can care for each other and which wish each other well no matter what.
So very true to the core. And along with MEHOP, Celeste, you are also associated with the Texas Association of Community Health Centers. How do you allocate your time for both MEHOP and Texas Association of Community Health?
I told you I don't have the best of work-life balance. So I do spend quite a bit of time working on MEHOP things. Now, the beautiful thing is the Texas Association is a technical support arm for all federally qualified health centers in the state of Texas. And of course, MEHOP is one of those. So even though I'm working on those days, I'm working with TAC, I'm still working in the best interest of MEHOP. So we just make time to do the things that need to be done.
Right. And I also see that you have a long-standing relationship with a lot of education institutions like junior colleges and all. You want to highlight some of those relationships with the schools and all?
Of course, we have always believed that it's important to reach out to those universities because those universities and colleges are bringing individuals with the talents that we need at MEHOP and other health institutions. So we partner as far away as the Arizona School of Dentistry to have dentist interns here into our clinic. We partner with all local colleges, Wharton County Junior College, for example. Wharton County has various programs for dental assistants, dental hygienists. So we work with them. Our dentist has sat at one time on their board. We work with all the schools, major ones in Texas. So that would be Texas A&M, University of Texas, Texas Tech, and many, many others on their particularly mid-level programs, and mid-levels being physician's assistants or nurse practitioners. And we are constantly having rotations for those physicians in our clinic.
Right. And MEHOP is also providing or giving away a lot of free kits to people who are in need. We would like to hear about the programs that you conduct on this part, like distributing of the free books and the medical equipments. Can you also focus on some of those aspects for our listeners to understand and basically see if they could take this knowledge from you and provide the right information to the people that they can connect with?
Of course, we've had a long partnership with Direct Relief and AmeriCares, and those institutions provide us free of charge many free over-the-counter prescriptions, even prescriptions that we can then give to our patients. So we've done that for many, many years. And those we have every year we get hurricane supplies, and we have put those into use when hurricanes came through the area. We do everything we can to work with our patients. One of the things you're highlighting is we have programs with Reach Out and Read and First Book, where we give free books to the children. Thanksgiving, we give away free meals. I think we gave it to 20 families last year. We donate to the toy drives. We do anything and everything with our partners in collaboration in the community to serve the community and to make their lives better outside the walls of our clinics.
That's a huge difference. And what additional thing can expected from MEHOP in future? What programs, new programs that you're looking forward to incorporate as we progress?
As we've started the conversation, we do offer all aspects of primary care, and we do offer some specialty care. We have a gastroenterologist. We are adding a pharmacy this year, so that'll be new, and that pharmacy will enable us to offer more of our 340B, which is a low discounted drug program, to the community. So we're thrilled to be able to do that. And what I think you'll see is just continued growth and support in at least Matagorda and Wharton counties.
Right. Celeste, one personal question.
Sure.
You started off with chemical engineering from West Virginia Institute of Technology, and
Yes,
then you are right now the CEO at Matagorda Episcopal. How has been your journey?
Oh, my journey. I feel like I've lived several different lives. I came to MEHOP because it was literally through I was delivering a sermon on stewardship one year, and someone heard me and realized that they didn't realize I was a chemical engineer and didn't realize I had industry background. And once they did, they invited me to volunteer here at MEHOP, and one thing led to another, and I took over in 2008.
Awesome. Actually, everybody in the society is actually great to have people like you lead these organizations. I mean, you make a difference for most of the people, and that difference is bringing a huge smile in many, many lives out there. Thank you very much for joining us today, Celeste. It's been a pleasure talking to you.
Absolutely. Thank you so much.
Thank you. You take care and have a wonderful day.
You too. Bye-bye.
All right. Bye-bye.